Thank you for tuning in to Assured In-Home Care. At Assured, we really try to differentiate ourselves in a few different areas. The first area is we do care for all age groups. You know, your loved one may be 50 had a stroke, or 60 with cancer, or 80 with Alzheimer's. It doesn't matter. As long as they need a loving, kind caregiver who's well checked and well trained and has a great, wonderful, kind heart, that's what we're here for. And we really do try to match up our caregivers with our clients in their home. However, if you have special requests, you can always give them to our care manager and they will try their best to make that perfect match. Every older adult is so different. They can have a preference of male or female, or whatever they feel is going to make them more comfortable. Maybe someone who's older, an older caregiver, or a younger caregiver, whichever their preference is. One thing I do want to mention today is in-home care, especially in California, there are guidelines and rules, and we are licensed now. We were never licensed before, but now we are all licensed, fingerprinted, and it's really helped the industry quite a bit. But it's also made it a little difficult because there's waiting periods to hire and some other issues that sometimes can cause issues and problems. However, it seems like it's moving much faster now. One idea is some families will ask the idea like, do you understand the difference between hourly versus live-in? That's a common request. Or maybe they think this idea is going to be better because they were paying for shift care and it was too much money, and they want to save money with a live-in. We don't usually use the term live-in any longer due to some case law, and we really try to use 24-hour care, but the 24-hour caregiver that lives in, however you want to say it, is less expensive than an hourly employee. In California, you can have the hourly employee work 9 hours at straight time, and then anything over that is time and a half, 24 hours a day. So having two shifts, if you had the 9 hours, then of course you have the overtime to get to 12 hours, then you have another 12-hour shift. It can be very costly, and it can be very confusing to someone who's recently had a stroke or maybe just had surgery. They might only want one person in the home. That person has to be paid for 24 hours, which they are. There still is it's still a little bit less money by the time we work it out. Most companies take a cut of the profit and give it to that caregiver. The caregiver's paid quite a bit to stay in the home because they're paid 24 hours, but they do need to get 5 hours of sleep at least. And you don't want a caregiver who really isn't sleeping at all. Even though they're being paid for the 24 hours, they really need 5 to 8 hours. 8 hours is more like it just because they really need to rest and be on their best in the morning to help that person. However, if your loved one sleeps 6 hours and then takes a nap in the afternoon, they could probably work that out with you as well. There's really a kind, loving feel to having a live-in. It's almost like having that best friend living there, helping you and bonding with you and knowing, exactly your needs and wants and how you want your eggs made or how you want your food made or prepared, or really laundry detergent. It goes on and on. They know them better just because they're there for an extended length of time, and they do tend to live in the room next door or nearby. Some tips for having them there is probably a baby monitor's good. Those monitors you can hear from, just so they can hear anything during that 5-hour period. Probably also it's critical that you really go over your expectations with them. Even though you're using an agency, most likely, you still want to say, I'd like a schedule for the caregiver. I'd like mom to eat at this time, then to go for a walk, then to maybe go out to the movies once a week, or whatever your schedule is. You need to write it down and post it and really have that conversation with the caregiver and the agency about your expectations. That's critical. Another really valid point in in-home care, especially with live-ins, is to make sure you don't have a live-in 7 days a week. That is going to really not work out in California under the law, but you also don't want to burn someone out. Someone should really work 4 days and 3 days, just so you have that fresh person. And 2 people if your mom or dad is getting used to 2 people a week, is really doable. They really can bond with 2 people. Bonding with 4, 5, or 6 people with all the shifts is harder, especially in your own home where you feel those are my items, that's really the home I built, I paid off, and older adults are very protective of their home, which of course they should be. So it's tough having so many people coming in and out that revolving door. So anyway, if you have any questions about live-ins versus hourly care, we encourage you to call our Assured In-Home Care phone number. Thank you for tuning in.